Are you trying to figure out what birth control to use next? Then I have information that's important for you to know before you make that decision. Hey everyone, so it's great to be back. We're going to talk about some important information today. Let's talk about just really some myths about different types of birth control, some things that distinguishes birth controls from others. So I'm not going to go through the foundational information like how often you take it, is it a pill, is it a ring, and all those different types of basic information. I'm going to assume that you either know that information or could easily access that information. I really want to focus on today talking about things that are really unique to different forms of birth control. And then I'm going to have you let me know which birth control do you think is number one in the US and which birth control do you think is number one in the world? This may surprise you. So go ahead before I even continue, drop your answer below. Don't cheat. So later on throughout this video, you'll hear me reference those particular types of birth control. So first of all, let's talk about just birth control in general. So the first thing that you should know is just how often are we using birth control to begin with? According to the CDC, the mean or average age of the first sexual intercourse for females in the US is age 17. As a result of that starting age, most women will, or most females will be using birth control for up to 3 decades of our lifespan. The other thing to clarify is what do we mean when we say birth control? So oftentimes when I say the word birth control, the first thing that comes to mind is hormonal birth control. But the truth is there are a number of non-hormonal ways that we can prevent pregnancy. And birth control just simply means that. It's a method that someone uses to prevent pregnancy. Now, what we're not going to cover, but should be covering soon, is birth control for men and where the research is in that arm. But there are currently male birth control methods, right? So withdrawal is primarily the partner withdrawing before ejaculation. And male condoms are for men. So those are already male forms of birth control. We just don't have on the market yet hormonal birth control for men. So just to clarify sort of the distinguishing terms that we use to make sure we're all on the same page. So there are male birth control. There's just currently no widely available hormonal birth control for men. Nonetheless, the majority of birth control methods are on the shoulders, so to speak, of the female in the relationship. So let's talk about some key things that we should really make clear. One of the things we want to do is empower women to know that when we say family planning, it shouldn't automatically go to birth control, right? Somehow we got into this, this culture in which family planning has become synonymous with birth control, and they're not the same. Birth control methods or your chosen or preferred birth control method is a part of your family planning. But when we talk about family planning, we're talking about more wider terms. What is the vision for your family? When do you want to have your next child? What's important to you in terms of your fertility? How many children do you perceive or wish or desire for you to have? And what is the time frame in which you would like to be pregnant? How old would you like to start your pregnancies? How old would you like to be completed in terms of your pregnancy? So family planning is a much more broader strategy in which women are given the ability to be empowered to make intentional decisions about our fertility and how we manage our fertility. And as a part of that, we will choose a method that will prevent pregnancy during the time periods that we do not wish to be pregnant. And that is what is termed birth control. And within that term is either your hormonal birth controls or your non-hormonal birth controls. Okay, so let's talk about some overall things that we should all be aware of. Not everyone who's on hormonal birth control is sexually active. So we oftentimes will use hormonal birth control to control or treat a number of other conditions. It's oftentimes used for chronic pelvic pain conditions, often used for endometriosis, used for PCOS, used for just in general irregular menses, used in conditions such as fibroids. So don't assume that everyone who is on some form of birth control is using it because they're sexually active. Very commonly, we use birth control also to suppress ovulation for those who have even physiological cysts that come and go with their menstrual cycles. So now that we've gotten that basic but very critical information, let's talk about different types and categories of birth control, of hormonal birth controls. So we're not going to spend that much time today on the non-hormonal birth controls because a lot of the myths and a lot of the misinformation has been as a result of hormonal birth control. So we really want to focus on those topics today. So one of the first things that we wanted to distinguish is you have groups of birth control that are either combined birth control methods or a single hormone method. This again is under your hormonal birth control. So those that are your combined birth control methods will contain two categories of hormones. They will include a type of estrogen and they will include a type of progesterone. Those are the major hormones, sex hormones that control a woman's cycle. So those particular birth control methods will consist of a type of estrogen, and there are different types and different types of progesterone. When we have the single hormonal methods, and that will include, for example, your Depo-Provera shot, certain types of birth control. So the far majority of birth control pills are going to be combined and they're in different levels of hormone. And we use different levels of hormone depending on sometimes if we're just using the pill as a birth control, or sometimes if we're utilizing it also for additional benefits at higher doses for different reasons. So those that are single hormonal methods will be solely progesterone and will not consist of estrogen. Estrogen, I think of as almost like a pro-growth hormone. And I explain why in a little bit. So those that are solely progesterone are really good methods, for example, for those that don't tolerate the side effects of estrogen very well, those that may be hyperestrogenic, they have an excess amount of estrogen, and we're trying to control their cycles. For those who are breastfeeding, the progesterone only methods are really beneficial in these particular groups. And so that will include your Depo-Provera shot, your mini pills. So, and there's a number of different brands of mini pills. It will also include your IUD, which is less systemic compared to the other forms of birth control, as well as your Nexplanon implant that goes in the arm. Okay, so now that we covered that, let's understand why that's important to make that distinction and how does it result in or change your cycle. So the progesterone only methods are really good in reducing the amount of blood flow that a woman or female may experience with her menstrual cycle. However, in the very beginning of using these different forms of birth control, some women will experience or may experience sort of erratic, abnormal, dysfunctional type of bleeding. Usually, if you continue that form of birth control for a longer period of time, 1, 2, 3 cycles, you will see a more controlled pattern and oftentimes a much lighter cycle, or depending on the type of birth control method you're using, and some women will experience no bleeding at all. So let's talk about the no bleeding at all, because that sometimes makes women feel a little bit uncomfortable. I'm not bleeding with my cycle. What does that mean? Well, the one thing we want to distinguish is the difference between not bleeding with your cycles or not having irregular blood flow when you're not on any form of medication with the intention of doing so, versus someone who is on a form of birth control and is experiencing a very known side effect. In some cases, women actually seek different types of birth control because they're looking for that benefit. So if you are naturally not having a regular cycle and you are not perimenopausal, and you are in your reproductive years, then that is something that should be evaluated to find out why you're not having a regular cycle versus those who may be on a progesterone only method and not having a cycle as a result of that type of birth control. The difference is the progesterone only method is going to ultimately reduce the amount of estrogen and progesterone that's being produced by your ovaries. And the result of that is during that part of your cycle where the inner lining of the uterus, called the endometrium, starts to get thicker in preparation for potential pregnancy, that doesn't happen. And so there's really nothing to shed. And so you won't get that usual bleeding, or you'll get a very light bleeding just because that inner layer is not getting thick and preparing for pregnancy. The other thing to keep in mind is that women who are on the combined hormonal methods may sometimes also get irregular bleeding here and there, and may sometimes have a very lighter blood flow. But in comparison to the progesterone only methods, it is way more common with those methods than the combined birth control methods. So that being said, just to make it clear, if you're on a progesterone only method and you have either a light cycle or no cycle at all, it is certainly not because there's anything that's backed up in your system that isn't being shed or isn't being withdrawn so that you can bleed. There's nothing that's being backed up. There's nothing that is going to put you at risk. In fact, the opposite is true. We oftentimes will use these particular methods to protect the uterus for women who are particularly at risk for certain types of uterine cancer. So again, it can give some protection. As a matter of fact, now that we're talking about cancer risk, let's talk about it, because this is oftentimes a question that comes up. So hormonal birth controls can decrease the risk of endometrial and ovarian cancer. And for some women, that's really important because they have personal risk factors. However, hormonal birth controls can slightly increase the risk for breast cancer. So that being said, it's really important to know your personal history, what cancers you may in fact be at risk for, and have that conversation with your clinician as to whether or not hormonal methods, and if so, specifically which hormonal method will be the best option for you. Also keeping in mind that as much as we focus on the birth control methods as potential protection and either protecting or reducing our risk for different types of cancer, it's also important to know that other aspects of our lifestyle is even more critical when it comes to preventing cancers. So we know overall endometrial and breast cancer have a link in terms of our body mass index, our level of activity, especially with breast cancer, and how a healthy lifestyle that we live. Are we drinking? Are we not drinking? Are we smoking? We're not smoking. Those are really important. Are we active? Are we sedentary? Those are important lifestyle factors to also pay attention to, and not just focus on the medications without really optimizing other aspects of our health. So there are certain types of medical conditions or chronic medical conditions that should be discussed with your clinician first before starting any type of hormonal birth control. So certainly anyone, for example, and certainly the list is much longer than what I'm describing currently, but those who have a risk for forming blood clots or may have a personal history of blood clotting, and that's again, those are not blood clots that you're passing out through your reproductive tract as a result of your menstrual cycle, but blood clots that are actually forming in your vessels, either in your legs, and more critically, those that supply your lungs or your heart. Those who may have high blood pressure, especially those who are already smokers, those who have uncontrolled diabetes, migraines with an aura, those who have liver disease, those who have certain types of cancer or may be at risk for certain types of cancers, women who have a history of significant cardiovascular health conditions, so such as having a history of a heart attack in the past or even a stroke. These are conditions that should definitely be discussed with your clinician. And for those also who have undiagnosed uterine bleeding. So if you have undiagnosed vaginal bleeding, I should say, just to to incorporate everything. If you have undiagnosed vaginal bleeding that's abnormal, then these are not considered to be good candidates for hormonal birth control and should really have a very important conversation with your clinician before starting any type of hormonal birth control. So hormonal birth controls are prescribed by your clinician. And so for all of the methods we're going to talk about today, you cannot currently get them over the counter. They do have to be prescribed and managed and monitored by your healthcare provider. And that can include anyone from your family clinician to your midwife, to your women's health provider, whether it's an OBGYN or a midwife, as mentioned. So that being said, I wanted to go on and talk about birth control pills. So birth control pills have been on the market for a very long time, and they are in fact the number 2 more commonly used form of birth control in the US. And birth control pills first came on the market in 1960s. Since then, there has been significant modification and just a rapid growth of a number of different types of birth controls that target different issues for women. So the other important thing that we mentioned just previously is that birth control, into hormone birth control, oftentimes is used to treat different types of reproductive health conditions. And oftentimes birth control pills are one of the most familiar form of birth control that women will choose to treat those conditions or to use as a form of birth control. Now, the primary indication for birth control pills is and will always remain the prevention of pregnancy. When we talk about other conditions, we're talking about secondary conditions that the birth control pill has been used to treat. But the primary purpose of all of the hormonal methods that we will be talking about today is the prevention of pregnancy. Now, birth control pills used to be, when it was first introduced, used to be in a dosage that's 2 and 3 times the amount that we typically use now. So there's been a significant reduction in the amount of dose of birth control pills. And that's important to know because when you talk to women who are in the older generation in your family, the birth control pills that they are familiar with were higher dose. And so they may report a history of having more side effects like nausea, vomiting, breast tenderness, headaches, than those that occur now with the lower dose of birth control. So it's important to know that time difference between the birth controls that were originally on the market and the birth controls that we use now, birth control pills, that we use now, that the dose is very much significantly lower. And so the experience of your grandmother or even your mother may not be the same as your experience because of those differences. One of the things that's really important when we talk about birth control pills in particular, because this is very unique to the birth control pill, is the timing of taking the pills. So one of the things that's important to talk about is perfect and actual use. So when you talk to your clinician about what is the efficacy rate of this particular form of birth control, for some forms of birth control, it's really important to know the difference between the actual use or the observed use or practical use. It's named a couple of different things. It means what really happens, right, when people use this form of birth control versus the model of use that is perfect. So if I perfectly take my birth control pills every single day, my efficacy will be different from the average woman who sometimes have busy lifestyles, sometimes forgets, have different things that affect their ability to be consistent with taking their pill. The birth control combined hormonal pills, those are the ones that contain your estrogen and your progesterone, are more favorable for those that may not be the most consistent with taking a pill or medications at the same time every day. So you just need to take those pills every day, right? They're a little bit more forgiving. Whereas the single hormonal pills are very specific to being used at the same, their efficacy rate is very much tied to a woman's ability of taking the pills every single day at the same time. So those particular type of birth control pills very favorable for those who are breastfeeding because they're less likely to have an impact on their breast milk production. But at the same point, at the same time that we're using them more commonly in women who are breastfeeding, you're talking about women who are more likely dealing with a newborn or an infant and have very busy lifestyles. So one of the things I often tell my patients or advise for my patients is to set an alarm. One thing we almost all carry all day long, 24/7, maybe sometimes badly to bed, is our phones. And so if you set your alarm on your phone, and set 2 alarms just in case the first time it alarms, you're busy doing something in that moment, send a backup alarm so that just in case you may have forgotten in that quick moment, you have a reminder to take your medication. So at the same time, it's really unique and really important for women to be real with yourself. If you're not the type who is good at taking a medication on a daily basis, or you tend to have upset stomach or sensitive stomach, or you tend to be just sensitive to pills, hormones in general, birth control pills may not be a good option for you. And it's important to have that realistic conversation with yourself before you even involve your provider. Okay. Now let's talk about another form of birth control that gets a lot of, I would say, confusion. So let's talk about Depo-Provera. So many of us may be familiar with Depo-Provera being the form of birth control, which is an injection that you get every 3 months. Now, the good thing that came out of the pandemic, if there ever was a good thing, one of the good things that came out of the pandemic is the fact that there was the release and availability of the subcutaneous Depo-Provera injection. And so traditionally, Depo-Provera has been an intramuscular injection, and now there's a subcutaneous injection in which patients can take on their own at home. So one of the things that I think attracts patients to Depo-Provera is the fact that it's infrequent. The timing in which you have to take it or in which it's administered is infrequent. So it's given every 3 months, which is basically 4 shots per year. And for some women, 4 shots per year is so much easier to deal with than something that they have to do weekly or even daily. And also it's private. So whereas you may not want people to find your birth control pills, you may not want people to find your ring package or your patch or see your patch on your arm. Depo-Provera is a shot. Nobody knows that you're getting it. It's very private. But Depo-Provera has had some issues, and a lot of women need or are looking for some clarification. So one of the things that initially got a lot of feedback about the injection is weight gain. Now, there are other forms of birth control that can cause some weight gain, but I think the biggest attention when it comes to weight gain has been the Depo-Provera shot. And the shot, initially, there was some confusion or there was some lack of uncertainty as to whether or not there was a significant weight gain with women who are on the shot. Well, there was a later study that has shown that there is a increase or a significant increase in weight gain for women who take the Depo-Provera birth control method. And so that study included 700 women, and they followed the women over 3 years, and they found that there was an increase of an average of 11 pounds more weight gain, and an equivalent of about 3% increase in a woman's body fat percentage. So that being said, for women who weight gain is already an issue or their baseline weight may already be an issue or weight gain is a concern when it comes to birth control methods, then Depo-Provera may not be the best option for them. Or one of the things that I would say I have personally found in my group of women, and I've worked almost exclusively with women of color, is the more active the woman or the healthier the lifestyle of the woman, she's less likely to experience that weight gain side effect. That is not the science. That is just Dr. T's anecdotal feedback to you, is that my women who tend to be more active are less likely to experience that weight gain. My women who are more sedentary and not very active are more likely to see that weight gain. And just to give some perspective on the weight gain, so women who use other forms of, in this particular study, women who use other forms of birth control experience closer to a 1% increase in their body fat percentage increase, and about a 3 to 4 pound weight gain. So that's 3 to 4 pound versus 11, and then 1% increase versus 3% increase with Depo-Provera. So some other important things about the Depo-Provera weight gain that we should make light of is the fact that the study has also found that women who had early weight gain with using the Depo-Provera were more likely to have continued weight gain, and the type of fat gain from Depo-Provera was more that belly fat, which we know belly fat is correlated to your cardiovascular diseases. So that's why we take this particular type of weight gain to be serious with Depo-Provera. The other important thing to know is that only a quarter of the women in the study actually gained weight. And so it still overall was not a large percentage of patients who experienced a weight gain, but definitely for those who did experience a weight gain, it was a significant amount of weight gain. However, for those who did gain the weight, it was a significant amount of weight gain compared to non-Depo-Provera users. The other important thing that they found was if you switched from Depo-Provera to another form of hormonal method, especially like the pills, you're more likely to have continued weight gain. For those who switched to a non-hormonal method, they were less likely to continue to experience weight gain. And in fact, they were more likely to lose the weight at a rate of about 3 pounds over a 2-year time period. So the other thing that's important with or unique with Depo-Provera is the return to an ovulatory cycle. So important in your planning is knowing that Depo-Provera can delay the return to an ovulatory cycle. So Depo-Provera is one of the form of birth control that reduces your ovulation, and hence its protective effect against ovarian cancer. But it can actually take a longer period of time to return to an ovulatory cycle. So on average, women may take up to 7 to 10 months to return to an ovulatory or a regular menstrual cycle. And so if you are planning to have a child and your time frame is really critical, you may want to come off the birth control method earlier and switch to another method until you're ready to start to get pregnant if the time factor is really critical for you, if your time frame of getting pregnant is really truncated. Now, there has been no studies that have shown, however, that Depo-Provera results in a decrease in fertility. It just takes longer for a woman to return to her menstrual cycle, to a routine or regular cycle. It doesn't necessarily impact her overall fertility. And now let's talk about the biggest controversy of them all. Let's talk about the black box warning of using Depo-Provera by the FDA. When you know something's a black box by the FDA, it's serious. So what is the serious concern? The concern is that they have found that women who have used this particular form of birth control have a decrease in their bone mass density. Your bone mass density sort of correlates in general to the thickness of your bones, which ultimately correlates in a woman's risk factor for things like osteoporosis and osteoporosis-related fracture later on in life. And so that's why this is really important, because there is significant morbidity associated with osteoporosis and ultimately osteoporosis fractures. There has been significant data that has consistently now shown that there is consistent bone loss or bone density loss related to the use of Depo-Provera. And the longer a woman uses, the more likely the impact. And what the studies have not shown is that all types of bone, whether it's your spine or your hip, don't all necessarily reverse at the same rate. But there is data that has shown that there will be reversal of that bone loss once a woman is off the birth control. The American College of OBGYN has taken a stance of if there is no other option and a woman wants to use Depo-Provera, and it's really important for her to use it as her chosen and selected and maybe sometimes her only option for birth control, then she should not be prevented from using this as a method for birth control. So it has not been removed as an option to be provided to women for birth control, but it definitely is. Any type of black box warning should be discussed with your clinician, especially if you have underlying conditions. You may be on steroid therapy for your lupus or some other condition, and may already be at risk for having compromised bone density to begin with. You may have a familial history. You may be of smaller frame or in the ethnic group that's at risk. Whatever your concern is or your risk factor is, definitely this should be a conversation with your clinician for all women who are considering using the Depo-Provera as a form of birth control. And what I did not mention was what we do not know is ultimately, does this bone loss, even though it's reversible, is there a correlation with having fractures later in life, with having osteoporosis related fractures later in life? And that is the data that remains unclear at this time. If we get updated information, I will be certain and happy to share that update with you. But as of now, we do not have that information. It is unclear, but it is being studied. So as soon as we have that conclusion, we will be sharing that with you and the rest of our community. So 3 things unique to Depo-Provera. We talked about the bone loss related to the use of Depo-Provera. We talked about the delay in the regression of a regular menstrual cycle. And we talked about also the concern with weight gain. Okay. So now we're going to move on briefly to your vaginal ring. All right. So let's talk about the vaginal ring. So one of the questions we get often with the vaginal ring is it going to give me an infection? So let's talk about that. The vaginal ring is now, there are 3 types on the market, and they're all very flexible and easy to use. So this especially, I think, in my experience, the women who have been most comfortable using the vaginal ring, I would say, if I had to compare the 2 groups, but this is not absolute. Definitely those who are tampon users are more likely to use the vaginal ring because they're more familiar and comfortable with their body, versus those who are pad users. Now, this is just a generalization. There are certainly exceptions in both groups, right? And so vaginal rings are very easy to use because you use them for 21 days out of the 28-day ish month. Okay. And so ultimately you're using them for 3 out of the 4 weeks of the month. Now, there are 2 rings that you will renew every month. So you use a new ring every month. And there's one that you wash it, you store it, and you use it when it's time to reinsert it to start your next month. The week that you're not using your ring is the week that you will ultimately get your cycle. This is a combined birth control method, and it tends to be a higher dose than your lower dose birth control pills, similarly to the birth control patch, we'll talk about it in a little bit. And so this particular method is very easy to use. You don't have to remember as often. So the important thing to know is that it will not disappear. Oftentimes I get this question, will it disappear somewhere, right? And the answer is no. And the reason why, I'm going to use my model to help us understand. So this is the vagina, right? Ideally, the cervix is on the inside of this. But as you can see, the ring goes inside the vagina. It cannot go anywhere because the cervix is closed at the very end of this uterus. And so it can't go into the uterus, and there's nowhere else for it to go because the vagina kind of blocks it from entering inside the body. So all of this is inside the pelvis. The vagina is the only entrance point, and it's the only exit point. That being said, sometimes you can have expulsion of the ring, especially during intercourse. And if that were to happen, again, the vagina is not sterile. So you're not dealing with something that needs to be sterilized. It just needs to be clean. So you just wash your ring if it falls out. And especially if it comes out during intercourse, it doesn't make it any less effective, especially if you reinsert it immediately. Just wash it off with some mild soap and water and reinsert it. And you are equally protective. If you have been having intercourse over a long period of time, didn't realize that it was out and it's been several hours, you need to check with the brand as to the time frame, because they have different time frame in which you are protected, a little bit of a grace period in which you can have it outside of the body and still have the same efficacy or not affect its efficacy. So you will definitely want to check with the brand to make sure that you're within that window, because it does differ depending on the type that you're using. That being said, the other question in terms of infection, if you are using it and cleaning it appropriately, most women will not experience an infection. But in general, because it is a hormonal therapy, some women are very sensitive to the changes in their hormones, and they may experience an increased risk for vaginal infections that occur as a result of having a change in their pH. Or a change in their ecosystem, I call it, in the vagina. So some women may be more prone to developing yeast infections or bacterial vaginosis as a result of the subtle changes that may occur as a result of a foreign body that is a hormonal-based foreign body inside of the vagina. Now, and a caveat to that, by the way, and for all these methods of birth control, that's really important to know, is that they are not protecting you against sexually transmitted infections. And so these methods are solely based, these hormonal methods are solely based on preventing pregnancy. They do not prevent you from getting a sexually transmitted infection. So you need to use another type or another barrier method, oftentimes a condom, to prevent yourself from developing a sexually transmitted infection. So when I talk about the increased risk of these infections, I'm specifically speaking and referencing the infections that are not sexually transmitted. But the caveat to that is if you are not having or using a method that protects you against sexually transmitted infections and you have symptoms of a vaginitis, definitely don't assume it's yeast or bacterial vaginosis, because it could also be trichomoniasis. Trichomoniasis is a form of a sexually transmitted infection and needs to be appropriately treated and immediately treated, and so does the partner. So making sure that you're not assuming it's yeast or bacterial vaginosis, especially if you're not using any form of protection against sexually transmitted infections. Now, the very presence of hormones in the vagina can also and more commonly increase a woman's physiological discharge. And why is that? Because the cells inside of the vagina, just like as a woman ages and she gets more vaginal dryness because of the decrease in estrogen that's being produced by her ovaries. Well, if you're using a product that gives you more estrogen to the vaginal cells or the vaginal tissue, you're going to have the opposite. You're going to have an increase sometimes in your natural physiological discharge. So all increased discharges doesn't necessarily mean you have an infection. Usually if you have an infection, you may have other types of symptoms like odor, itching, irritation, burning, sensation. Just having a physiological discharge is not a sign of an infection. But in order to distinguish which one you are, you would definitely have to see your women's health provider or your family medicine clinician. Now let's talk about the other point of confusion that comes up often, the birth control patch. So one of the things that came out about the birth control patch years ago is the fact that it does slightly increase the risk of a woman developing a dangerous blood clot compared to other methods of birth control. Now, overall, the rate of developing a blood clot is still low, even with the birth control patch. So the rate of developing a blood clot, again, this is blood clots in your vascular system, not blood clots coming out vaginally. The rate of that is considered to be low. In fact, studies have quoted 0.3 to 1% over 10-year use. So it is a really low percentage. So even with the increased risk with the birth control patch, it is still an overall low risk. However, the birth control patch, similar to the vaginal ring, is a higher dose of birth control. And the unique thing about the birth control patch is also that it is a single dose. So you can adjust the dose. And also you should know that It adheres pretty well, but do not place it near your breast. So that's the important thing to know about it. The other important thing to know about the birth control patch is that for women who are of higher weight, are more likely to experience a decrease in the efficacy of the patch, specifically those who are 198 pounds or more, which is equivalent of 90 kilos or more. So let's talk about your other form of birth control that gets a lot of myths. I think probably this form of birth control has the most myths about it. And the unique thing about it is that it's actually been on the market the longest. So we're going to talk about some of these myths. The IUD, or the intrauterine device, or intrauterine contraceptive, is a form of a long-acting reversible contraception. So that being said, the IUD, similarly to the Nexplanon implant, which we'll talk about in a few moments, are the most effective form of birth control in addition to your sterilization methods. So your sterilization methods, your IUDs, your Nexplanons are the most effective form of birth control, all about 99% effective. Now, there oftentimes is a confusion. As mentioned, the IUD has been around for a long time. In the early 1900s was when it was first introduced. So it's been around for a very long time. And worldwide, it is one of the most common or more popular form of birth control to this day. So why does it get a lot of flack? Because it's an implant. And there's lots of controversies when it comes to implants. So let's talk about some of them. One of the things that come up often is, am I going to get an infection in my wound? Infection wounds, it does happen. It's called pelvic inflammatory disease, and IUDs can be associated with PID. So what's the likelihood of this happening? It's actually not very common. It is about less than 5% or about 5%, depending on what resource you read. There are different types of IUDs. There's your hormonal IUD, and then there's your non-hormonal. Some women actually choose the hormonal methods because they want the secondary benefit of not having a cycle or having a very light bleed, a light flow of their cycle. So you will continue to have your cycle. This is just, I'm referring to the actual flow, the blood flow. So some women like to use the IUDs for that particular purpose because they either don't want to have a period or they hope not to have a period. There's no way to predict how they're going to respond in advance, or they want the option of possibly having a very light period. I already explained there's no harm in relationship to that. There's nothing being backed up in their system. It is just how the IUD works. And that's important to know also. The IUD works by making the uterine environment hostile to sperm. It also causes a few other changes, like changing your cervical mucus, but overall, it just makes the uterine cavity uninvited to the sperm. Uninvited guests. And so as a result of that, some people get confused as to whether or not it increases the risk for ectopic pregnancy. Yes and no. So overall, the efficacy rate is still 99%, which means the likelihood of it failing is still less than 1%, 1% or less, right? That being said, if a woman were to get pregnant with an IUD, she is at an increased risk of that pregnancy that is occurring in that 1% failure rate of it being an ectopic pregnancy. So overall, IUDs are still one of the most effective forms of birth control. But if a woman were to get pregnant and be in that small group of women in which the IUD was ineffective in preventing a pregnancy, she is more likely to have an ectopic pregnancy. So a woman who's pregnant with an IUD should seek medical attention immediately to determine whether or not the pregnancy is in the cavity or if she's experiencing an ectopic pregnancy. And then have the discussion with her clinician as to whether to remove the IUD immediately. Okay. That being said, let's talk about the risk for movement of the IUD. So the interesting thing about the entire body is that almost every organ in the body is made to move. So if you think about it, your lungs move, your heart moves, your bowels certainly move. They move a whole lot, right? Your bladder does a movement. It contracts, it expands. Your eyes move. your tongue moves, like name it. You go through a lot of organs, your extremities, of course, they are made to move. So a lot of things in the body naturally move. And so when you talk about implants being placed in the body, it's really hard to absolutely prevent an implant from moving because we're constantly moving. Every part of our being is moving. And so with implants in general, whether it's a heart implant, whether it is an implant in the eye, whether it's an implant in the ear, there's always a potential risk. And that risk varies depending on the organ, depending on the type of implant, but there's always a small potential risk of movement of that implant. Now, with the IUD, the positioning of the IUD is really important. It has to be really high up in the uterus to maximize its efficacy. Sometimes the IUD can come down a little bit, and sometimes it can expel completely. And that is probably one of the more common side effects that you can get from an IUD is that it may expel. It's very common to expel, especially with those IUDs that are placed close to the time of childbirth or at the time of childbirth. That's a high expulsion rate. If it expels, does it mean that you cannot use it again? Absolutely not. There may be unique circumstances associated with the expulsion of the IUD. The partners, oftentimes male partners, will say that they can feel the IUD strings. If the IUD strings are cut long enough and sufficiently enough, they will come out of the cervical opening into the vagina and kind of lay over the cervix itself, especially with a woman's vaginal mucus and lubrication, they will kind of lay down. Now, if the strings are short and they're poking out like that, they're not going to lay down. And so the strings can be poking directly through the cervix, especially if they're short. And when they're poking directly like that, then yes, a male partner may in fact feel the IUD strings. So as you can see with this sample, you may not be able to see very well, but I'm going to put it very close to, you can see kind of that may work. You see how the imprint of the IUD is higher up in the uterus. So this is the uterus here, right? And you see the tiny strings that are coming out at the bottom there. It's reflecting my light. Okay, let's do it that way. So you see the strings coming out, and the strings will be coming out of the cervix, okay? And you see the IUD is in the uterus itself. So the IUDs are not very big. You can see, oh, that's even better. You can see the imprint here. They're not very big, but they should be higher up in the uterus. Now, can an IUD go through the wall of the uterus? Can it go through the muscle of the uterus and go out into the abdominal cavity? Yes, it can, because like any implant in the body has the ability to become embedded in what's implanted in. So important for women to know that you need to remember when it's time to remove your IUD, because if you don't remember and you have it in for an extended period of time, one, it's not effective, and two, you're more likely to have it become scarred in or embedded in the uterus and harder to remove, and requiring a minimally invasive procedure to help remove it. The other thing is we teach women to be able to feel the string coming out of the cervix. So women are taught how to feel those strings. They're very tiny, but if you are comfortable with your body, it's very easy to go up to the cervix. That typically will feel like the consistency of your nose, and feel the strings coming out of it. If you feel two strings, you're good. If you don't feel the strings, don't panic. It may have been that the IUD curled up inside of the IUD strings curled up inside of the uterus, but it definitely warrants investigation in the office to make sure that the positioning of the IUD is good. The rate of it perforating or going through the muscle layer is very, very rare. It is a less than 1% occurrence. It is a very rare complication, but definitely, of course, one that is concerning because something like that would require a surgical procedure. All right. So that being said, we talked about some of the common myths. Will it increase the risk of ectopic pregnancy? Overall, no. It actually decreases the risk of unwanted pregnancies. But if a woman were to get pregnant with the IUD, she is more likely to become to be at risk for an ectopic pregnancy. Ectopic pregnancy means that the pregnancy is not in the uterus, it is somewhere else in the body, oftentimes in the fallopian tube. We answered the question about infection rate. Yes, it can increase the risk for infection, but the occurrence of that is actually not very common. Can it expel from the uterus? Yes, it can. Some women may feel some cramping when it expels, but it's actually very well tolerated. The removal of IUD that's not embedded or implanted or in anywhere complicated is very, very simple. It takes seconds to remove it. And very well tolerated by patients. But there's certain things that will make someone more likely to have expulsion of an IUD. So you would absolutely want to talk to your clinician about that. We also talked about the rate of perforation, which is extremely rare, but certainly a very serious complication of using the IUD. The IUD, as mentioned, is one of the most common forms of birth control methods in the entire world. And finally, we're going to talk about the unique features or unique things about the Nexplanon. The Nexplanon is one of the newest forms of birth control, but certainly has been on the market for quite a number of years now, and is as effective as the IUD, and now claims to be even more effective than the IUD in sterilization. The Nexplanon is a popular form of birth control, one of which, because it's implanted in the arm and it's easy to palpate, so women tend to like the ability to be able to feel the Nexplanon. If it's done correctly, you shouldn't really, most women, you will not be able to see it, but certainly if they feel the area, they'll be able to feel the implant. It is a 3-year birth control method. It does contain hormone. It releases a low dose of a progesterone type hormone over the 3 years. The unique thing about it is the fact that the Nexplanon has been linked with mental health complication rates. So it has been linked with an increased risk for depression. And actually, there's a study that was recently done in Denmark that actually showed all hormonal birth control methods are associated with an increased risk for depression and suicide behavior. So, but the overall risk or the overall rate of mental health issues is considered to be still very low. But when they compared women who were on birth control, hormonal birth control versus those who were not, the Denmark study did show that there was up to a 3-fold increase rate of depression and suicidal behavior in women who are on the hormonal methods compared to those who were not on those methods. But still, the overall rate of those complications and issues were considered to be low. Unique to the Nexplanon is that it has been associated with increasing the risk for suicidal ideation, especially in those who have a pre-existing history of depression. And so in consideration of using the implant, it is important for that conversation, for especially for women who are at risk for mental health disorders or who may already have an underlying mental health disorders, to really consider whether or not this is the best option for them. It is an implant, just like the IUD, requires a minor procedure in the office, very well tolerated, both. And the procedure can be done in the office setting, does not have to be done in the operating room for neither of them. Under local anesthesia for the Nexplanon implant, women can immediately be able to feel the placement of the implant after the procedure. Does it have a risk of migrating? Yes, it can migrate. Serious migration is very rare also, but it is an implant placed in an organ that's meant to move. so you will sometimes get migration of it, but again, it's not a common side effect. That being said, if anyone has the implant and is concerned about perhaps it moving or feeling kind of a pinching sensation, that should be evaluated with your healthcare provider. So the most common form of birth control in the US and in the world, we did not discuss today because it is not a hormonal method. It is sterilization. Female sterilization is still the most common form of birth control nationally and internationally. What's really concerning, but we're going to get into that on another topic when we talk about male birth control, is the fact, I didn't mention this earlier, the vasectomy is still also a form of male birth control that I did not mention earlier. Shame on me. But now that we're on the topic of sterilization, it is a much easier procedure. than the female sterilization. But female sterilization is still the most common form of birth control. We need to switch that. It needs to become vasectomy. But of course, depending on what society you live in, that may not be favorable or favored, I should say. It certainly is favorable because the male organ is external to the pelvic cavity, to the pelvis, and to the abdomen, whereas the female's reproductive organs that are sterilized are used to be ligated to result in sterilization or in her pelvis, requiring access through her abdomen. So it's a much more complicated procedure, but overall, both are very safe procedures to be performed and very quick recovery rates. So I hope we have dispelled some myths, clarified some myths, added some additional information in terms of the what's out there and what's available in terms of studies for different areas that are unique to these different forms of birth control methods. So I hope we have caused and resulted in you having some clarity and made your decision a lot easier. The key is to know what's right for you, what's right for your girlfriend, what's right for your mom, what's right for your sister, what's right for your aunts and your uncles or aunties and your best friends may not be the right option for you. Birth control method is a very individualized, personalized decision because it's women make decisions not just on the medical aspect, but on the practical aspect. Do I have sensitive skin? Am I comfortable inserting something vaginally? Do I want to have to take something every day when I have classes, when I'm in college, and I'm sometimes too busy to remember? Do I want to risk using hormones when I have certain types of breast cancer in my family that are hormonal dependent breast cancers? Do I want to undergo a procedure? These are questions that women ask all the time. And these are great questions because answering these questions will ultimately help in that decision making. And one thing we didn't discuss today is there are nuances, such as the Depo-Provera in seizures, the Depo-Provera in diabetes, that we didn't really get into chronic disease management. If you want me to talk about that, like different chronic diseases and the preferred method of birth control for those chronic diseases, maybe we can do that on another episode. And if you want me to talk about that, then just let me know by putting a comment below. So once again, one of the things that I did not mention today, but I do want to emphasize before we wrap up is as much as we talked about side effects and potential complications and risk, please note that for a lot of things we talked about today, the side effects of hormones, the one thing that is more likely to cause hormonal side effects and all the things we talked about from blood clots to headaches and breast tenderness is pregnancy. So certainly our goal is to prevent unintended pregnancies because if you're concerned about blood clots, pregnancy is more likely to cause blood clots than hormonal birth control. If you're concerned about issues with headaches, women are more likely to get headache issues with pregnancy. Women will also have breast tenderness and soreness with pregnancy and breastfeeding at the beginning. Women will also, so a lot of these hormonal side effects, when we're talking about minimizing the side effects, we're talking about really using the method that is best for you with the lowest amount of side effects that you are most concerned about, because different women are concerned about different side effects differently. But if the one thing that categorically across all women is the most risky thing when it comes to hormones, it is pregnancy. So we want to make sure we make the right decision for ourselves and ultimately prevent pregnancy until we are ready to get pregnant. We know that unplanned pregnancies have way more adverse outcomes than planned pregnancies. We want women to really feel empowered about taking control of your fertility, deciding when you want to be pregnant with your partner or by yourself, no judgment, and then making a plan to get towards those goals. We're really good with planning our careers. We're really good about planning where we want to live and when we want to purchase a house, but we could do a lot better when it comes to planning our pregnancies. So I hope this information has been helpful to you. I hope it's cleared up a lot of the myths that's out there. And certainly if you have more questions, feel free to drop your questions below. This again is Dr. T. I'm the hand behind the handle of Healthy Bump Club. We thank you for listening And make sure when you're done listening to this video, check out our other videos. We talk about a whole lot of other topics you do not want to miss. And we talk about relevant topics. So the information we shared, even last year, is still relevant this year. And if there's anything that needs to be updated, all you have to do is check the content, because we will update the information in the content. But for the most part, our conversations and our information, because science really doesn't change that rapidly, are still relevant, even a year later or 2 years later. So make sure you check out another video. And then if you want to support us financially, you can support us financially by donating directly, or if you want to purchase one of our gear, you can purchase one of our HBC Village gear. You'll see an image of that towards the end of this video. Or you can support us through our fertility video. You'll see the link below. Or if you're a music lover, go ahead and hit up our link to our Apple Music account where you can purchase your items using our link and give us a portion of your purchase. So we thank you so much for listening. And we hope to see you guys when? The next episode. We out.